As we mark Stroke Awareness Month, understanding the signs can be life-saving. According to the American Stroke Association, it's the #2 cause of death worldwide and a leading cause of disability.
Let's turn now to Regional Chair of Neurology at Cleveland Clinic Weston Hospital, Dr. Amre Nouh. Thank you so much for being with us. First up, can you explain the most common warning signs of a stroke?
Yeah, thank you for having me. So it's really important to know the warning signs of a stroke. We usually like to talk about B fast, B being acute, sudden loss of balance, veering to one side or a feeling of imbalance. E for eyes, that can be loss of vision or loss of visual field on one side or even seeing double. F for face, which is drooping of the face or weakness on one side of the face. A for arm, that's weakness in the arm, or if you hold up the arms, one of the arms is drifting down. S for speech, that could be the quality of the speech, like slurring of the words, or even language, such as comprehension or ability to say something. And T is for time, because time is brain. And if someone does recognize these signs, should call 911 immediately.
So important to know those signs in the moment so you can help someone or even yourself in that situation. But what about looking ahead of time, the risk factors that might put one more susceptible to having a stroke in the future?
That's a great point. About 80% of strokes could be, described or could be attributed to one of these several key risk factors. The most important ones are being high blood pressure, which is a silent killer, can cause heart disease and subsequently can cause stroke, hardening of the arteries. High cholesterol, that's either from the diet or from being overweight or obese. Diabetes is a very important risk factor. Other lifestyle risk factors that include alcohol intake, smoking or drug use are also very important. And then lastly, sleep apnea actually is an under-recognized risk factor for stroke as well.
All really important points. And so speaking to that in terms of personalized medicine, how are stroke patient treatments customized based on the individual risk factors or the genetic profiles?
That's a great point. I think in the acute setting, when someone's having a stroke and coming to the hospital, they're evaluated emergently by the team, and depending on what kind of stroke it is, if it's a ischemic stroke where there's a blockage to a blood vessel, depending on the patient's age, depending on what kind of timeline it is between the symptoms and so forth, they can be eligible for treatments like clot-busting medicines or clot retrieval, or if it's a bleed of some sort or an aneurysm rupture, there are also different types of modalities that are available on the acute side. And then for secondary prevention, it depends on the underlying cause. Addressing the individual risk factors are very important. Genetics plays some role, but not a very important role. Most of the risk factors are modifiable, such as the things we talked about. So secondary prevention is important because 1 in 4 strokes is actually a recurrent stroke.
Great information there as we mark Stroke Awareness Month. Dr. Nouh with Cleveland Clinic Weston Hospital, thanks for being with us tonight.
Thank you for having me.